Dear panelists, dear participants to this webinar, welcome. The African Water Association is a Pan-African organization made up of water and sanitation company, as well as goods and service company related to the production of drinking water and sanitation. Its goal is to strengthen the capacity of its members, particularly through the sharing of information and good practices, so that they can provide drinking water and safe sanitation services to the population. The theme of the today's webinar is Challenge and Prospect of Sanitation Service Delivery in Africa during the COVID-19 pandemic. There is no need to recall here that the sanitation operators provide an invaluable service along the sanitation chain, from containment to treatment, recovery or reuse of byproducts. Many of us notice their importance only when confronted with blocked, filthy toilets, or overflowing septic tank. Their work is, however, essential to the proper functioning of the sanitation system that underpin daily life. This is why, despite the COVID-19 pandemic, their service continue to be in full demand. The spread of this pandemic at a global scale has created an unprecedented health situation, but also an environment that is greatly disturbed and constrained, not only by the disease, but also by the crisis management measures taken by a large number of governments and affecting a significant part of the world population. The World Health Organization has advised the observance of hygiene rules, such as hand washing, mandatory wearing of masks, and even lockdown as barrier measures against this disease. How do these sanitary and crisis management measures affect sanitation service provided by the public and private sanitation operators? What adjustments have these different players taken or intend to take to continue to play their role in a sustainable way? It is to answer to all these questions and many others that I invite you to welcome the following panelists, whose expertise and work in the field of sanitation in Africa are well acknowledged. Mrs. Eva Moore is the president of the Kenyan Septage MTA Association and vice president of the Pan-African Association of Sanitation Actors. She is based in Nairobi in Kenya. Dr. Najib Lukoya Bateganya is the deputy director of Environment and Sanitation of the Kampala Capital City Authority. He is the key person of many sanitation projects held by KCCA. He will respond from Kampala in Uganda. Mrs. Lungi Zuma is a chemical engineer at eThekwini Water and Sanitation Unit in South Africa. eThekwini Water and Sanitation Unit has been mentoring many African cities and utilities on water and sanitation. Lungu is in Durban. Last but not the least, Mr. Kennedy Mayumbelo is the program manager, Lusaka Sanitation Program, one of the major sanitation programs funded by the World Bank in Sub-Saharan Africa. He works at the Lusaka Water and Sewerage Company and will be responding from Lusaka in Zambia. We have obtained a special participation of Kat Medlicott, who lead the World Health Organization work on sanitation and wastewater. She is based in Geneva and will respond eventually to any technical question related to health and sanitation. This webinar is organized in two parts. First, I have a couple of burning questions that I will invite the panelists to respond. Then they will respond in the second part to the question of participants selected by our MNE, Monique Avwaka. Please feel free to use the chat box under to ask your question to the panelists. And at the end of this webinar, you will receive a link to respond to a short survey about this webinar. I jump to the first question to all the panelists. How the COVID-19 has affected your operations, and what measures have you put in place to overcome the challenge encountered? I start with Dr. Najib.
Thank you so much, Professor Ives. And dear participants, thanks for joining us for this interesting conversation. As we already know, the COVID-19 pandemic resulted into a lockdown, and Kampala, of course, was not spared. Definitely, this created a lot of scaling down of the operations in both numbers of personnel and also the capacity that we have to offer services. And here I'm talking about pit emptying services and also waste management, which we deal with as Kampala City. We've also noted that because of this lockdown, people's income is definitely disabled, and that creates problems for demand for private services. In Kampala City, over 60% of the market share is private sector based. So if people are not willing or able to pay, then you have challenges of waste accumulation in communities. The third one related to waste and fecal sludge management is, of course, we had to reduce the hours of operation from over 14 to less than 8 hours. So what we've done to deal with this challenge, especially to make sure that service is sustained, one, for solid waste, we increased public service coverage to operate even in areas where private sector was operating, because people were then not willing to pay the private service providers. For fecal sludge management, our team has come up quickly to develop a quick subsidy system for relief emptying. This is mainly focusing in high-risk informal settlements. This subsidy system is voucher-based, and these vouchers are distributed in these high-risk areas to pits that are full. The service is then provided by the private service providers using our call center system. So the clients are advised to call the call center and then access a private service at a very subsidized rate. The last one is, of course, we've intensified risk communication in communities alongside the COVID-19 messages for improved hygiene and sanitation, and our call center operations to respond to this demand from communities has been increased from 12 operational hours per day to 24 hours every day. So these are some of the things that we've intervened, especially in waste management and sanitation.
Thank you, Dr. Najib. I give the floor to Mrs. Eva. How have you deal with how have the COVID affect the sanitation worker in Kenya?
Thank you, Prof, for having me here in the panelist. In Kenya, it's lockdown, just like Kampala, like Uganda. But I live in the capital city of Kenya, that is Nairobi, where we have been locked down as Nairobi, because this is where the highest COVID-19 population is. So coming from the private sector, starting with the transportation of the emptiers and going to the empty and to the pit emptying. It's very interesting because I don't think in the history of Nairobi we've had where families have been in the house for 2 months. So the accumulation of the fecal sludge should be in like numbers of doubles and triples. So the septic systems are filling in very, very fast. So the issue here is the willingness to pay, and it is also not like a refusal to pay, but most of the people are not working and they're not going to work. So where the emptying is done, there are people who are dependent on an end of month salary, and most of them have a cutout in the factories. So you find the go to the point of where they're supposed to be exhausting. Maybe usually they do it once or 3 tracks, and now they're about 6 tracks. So we have to give a lot of credit facility. And credit facility, looking at it from a high risk, because you're not so sure whether at what point this money will be paid, but you still, because these are your long-term clients, you still have to sustain them and you still have to keep them as your client, or the negotiation comes in if you bring the prices down. But we are planning to talk to the county governments, the municipal county governments, to see if they could do a facilitation of waivers of licensing of the payments that needs to be paid to the county governments, because that can be able to help us to bring the prices down when it comes to emptying. And when it comes to wastewater treatment, and for those who are still the same value chain, because we are wide in the value chain, we don't have emptiers only. We also have people dealing with wastewater treatment. A similar thing is happening, whereby you want to give the products for the wastewater treatment, but then the willingness to pay again, because the water utility companies that you work for or you give these products to, also the water bills are not being paid in time, because actually in Kenya, the president said that there is no citizen in this country that their water should be cut because they don't pay their bills during this COVID-19 time. So you find that also then they don't have money to pay you back. So here in the section of the private sector is the same. It's about are they able to afford to have the sanitation facility and have sanitation products or equipment or transportation, or these services rendered in unusual way. It's unusual. So we are adapting to the new norm, because we are calling it a new norm. I don't think we are going to go back to where we were before, and see how we can be able to adapt. But the positive side of this new norm is, because right now it's something that we are facing, all of us. So negotiation and talking to each other has become very easy, and everybody is listening to everybody. And they were listening to each other and seeing how do we take this forward. Supposing it's going to be like this in Nairobi for the next 6 months, it's going to be like this in Kenya for the next 1 year. So how are we going to work together to make sure that remains at the highest protective part of this COVID-19? And the other issue that we are finding very interesting is the pit emptying, the manual pit emptiers, where that is the informal settlement. Most of the informal settlements depend on the day-to-day wages payment. So the people who are supposed to be paying these are not able to pay. And so the manual emptiers are refusing to go and empty for them, because for them, really, there's no consideration of a long-time client, a small-time client. So we are looking at a situation, how are we going to avoid a risk like cholera outbreaks during this time in the informal settlement? And these are the conversations we are having from the private sector to the government level to the parastatals in Kenya and in Nairobi, having this discussion and laying these platforms into place, and what can be done and how can we sit together and be able to work out. We are all in the Zoom era, and we are trying to do all this coordination of Zoom meetings, and it's not been working very well from government, parastatal, private sector coming into the Zoom. People are not used to this. So this platform are on the foundation basis. So we've not been able to concretely sit and say this is the next direction. This is the way forward, but we have to look at it, because like Nairobi, we are again on 21-day lockdown, which has happened. It's been renewed again, and we are not so sure whether it's going to be renewed again. So we have to find a way of meeting and having these discussions into place. Thank you.
Thank you, Eva. I handle the microphone to Kennedy. Kennedy, what is the situation in Lusaka? How does the COVID has affected you, and what measures have you taken? Thank you.
For Lusaka, the situation is slightly different from, I would say, Kenya and Uganda, in the sense that we don't have a lockdown either for the whole country or even for the whole city of Lusaka. But the government locks down sections of the country where they deem that are deemed as hotspots, and then they deal with that situation there. But that still hasn't spared us when it comes to the service provision, both of water and sewerage or sanitation services. When the situation was announced and government announced its guidance on what people are supposed to do, the usual guidance of wearing masks when in public places or social distancing as in other places, washing hands and so on and so forth, people were very nervous in the beginning and they were very cautious. So a lot of people stayed home, and immediately we noticed an increase in terms of consumption of water supply. But the government, in guiding or trying to mitigate, gave pronouncements around issues of water supply, almost like what is happening in Kenya, that there will be no disconnections for defaulting customers. Now we depend entirely from the revenue that comes in from our customers, so that has resulted, as you can imagine, in loss of revenue quite significantly. I think our revenue has probably dropped by around 50% even. But when it comes to issues of sanitation, and actually water supply and sanitation as well, we've been considered as essential workers. So in terms of reducing the operating time, that has not happened for us as a utility. Instead, we are being requested to step up our service provision. So the resultant is that where we're not covering in terms of water supply, we are having to look for temporary water storage tanks, especially in the peri-urban areas or in the poor areas, neighborhoods of the city of Lusaka, and then having to use our bowsers or having to hire bowsers to deliver water there on a continuous basis so that people have access to clean drinking water. While also in terms of pit emptying, we started, Lusaka Water and Storage started a different line of business. We call it the Ficus Large Management business. So we engaged the private sector wholly to try to ensure that they carry out this service while we provide the services of treatment of the sludge when it comes to the treatment plants. So essentially, the private sector is providing 100% of the pit emptying in the peri-urban areas, as well as while the utility only focuses on the sewerage service through piped the sewer network that we have in the city, which is less than 10%. So you can imagine the volume of sludge that they have to collect from the households and then take to treatment plants. The good part has been that the people have been quite responsive in terms of wanting to have their pits emptied, because we took advantage of the messaging around sanitation in the COVID period, that people should be willing to empty their latrines. Now, this service is heavily subsidized. As you know, it's just a business that we started slightly last year. And so we're trying to hook people onto this business, and eventually we'll build the cost of emptying to sustainable levels and remove the subsidy that is there now. So it has significantly impacted quite negatively the utility in terms of loss of income, like I said, and while at the same time put the pressure on the utility to find ways of providing this service with this reduced income. To an extent, for the employees, we've had to see how some could work from home, others could work from the office, and have alternating arrangements to avoid having the utility employees falling victim to this. So even the pit emptiers also enhance their health and safety aspects to ensure that they have proper PPE, they have facial masks as they go out there, they have sufficient disinfectants to clean up after they've done their emptying, as is required.
Thank you for this update. I now handle the microphone to Mrs. Lungi. Mrs. Lungi, you have the floor. Tell us. What is the situation in Durban? Well, how has this affected your daily operations? What measures have you put in place? Please tell us.
Thank you, Professor, and thank you for having me on this panel. In South Africa, like Kenya and Kampala, we've had a lockdown since the 27th of March. It has since been relaxed a bit, but we're still under lockdown, and only essential services were allowed to operate. And obviously water and sanitation was an essential service, but not all the departments within our units were operating during this time. So some of the departments that were operating has been the call center, the treatment works, and also the laboratories, amongst others. We've also had the same pronouncement from our mayor that there won't be any disconnection of water for any of our residents during this time. For the employees who have been working, we developed standard operating procedures just for their safety, so that when they are going to work during this time, they are provided with all the necessary PPE, so that's your masks, your sanitizer, and also daily screening of their symptoms in case they are, when they come into work every morning, there is daily screening. And in the community, for people who have had no access to water, or their access to water has been far away, we've also been providing water tanks, so in strategic places, and those are filled regularly, so people have access to water. We also have hand washing stations within those informal settlements, so that, you know, that message that we're driving, that people have to wash their hands regularly, at least they have the access to the water to do that. And we have encouraged our customers to use electronic methods of paying, because we usually have our customer service centers where people come in for payments and for queries. So we've encouraged them to use, you know, telephonic, even our WhatsApp line to answer their queries. And similarly to Lusaka as well, with the pandemic and the lockdown, we've seen that people have had, their income has been affected. So that has rolled down to us in that our revenue collection has also dropped. The drop from March to April has been just below 50%, and they're forecasting that it will drop even more in May. So those are the type of issues that we are currently working under.
Thank you. Just hold on, Lungi. You just mentioned that this situation has affected you, and we know that you are working a lot with sanitation workers. Has they lost their job? What are the measures you have put in place, or you intend to put in place to support the work of those sanitation workers?
Well, for the private sanitation operators in our city are mostly the emptying of the septic tanks, and also the provision of chemical toilets in areas where there isn't any sanitation currently. So those private companies have been operating under the lockdown because they're deemed to be essential, and the city has been using the services of people providing chemical toilets to put them in places where there's no sanitation as an interim measure. So those sanitation operators have been working during the lockdown, but under strict safety protocols, so that they don't get infected by the virus.
Tell me, Najib, this pandemic has revealed the importance of neglected jobs, such as those done by private sanitation operators. What measure have you provided, or you intend to provide, to ensure that this specific category of actors do not suffer permanently from the adverse economic effects of the pandemic?
Thank you, Yves. So what we've done for now is building on the relief emptying services, which is subsidized, and this is subsidized by government to pay private operators to offer a service to communities at high risk that are not able to pay. So building on that, we are now structuring a framework contract in advanced stages. So this framework contract is meant to provide private operators or companies more secure jobs to serve the communities and paid by government. So this framework contract is going to, one, guarantee, at least provide some security or guarantee of income to the service providers, but also it helps them gain more confidence in building their businesses, being aware that they are able to secure jobs from government. And this can also be used to access financing from either development partners or through commercial financial services. So this is something that we've been thinking to do before, but this pandemic has then accelerated our efforts towards securing this framework contract for the service providers.
Thank you. Kennedy, we know that within the Lusaka sanitation program, you have been working very hard and very closely with the MTA and other sanitation actors in Lusaka. Is there any specific measure you have put in place or you intend to put in place so that we are sure that this pandemic will not affect their work?
We've been working quite closely and very hard actually under the Sanitation program to try to ensure that we sustain the service. First, this pandemic was really an unexpected event which has kind of sidestepped us and blindsided us rather, and put us in a situation where we've now have to rethink some of the ideas and strategies that we've had. So to a large extent, we've had to engage these private operators. These are mostly who were in the informal sector. They were not recognized as people with formal jobs, so to speak. They were just emptying pits privately and being paid privately. We've organized this in a way that they are now recognized as a formal service provider. So we've been able to generate some specific operating procedures for them so that it's clear and these are communicated to the customers. We've also communicated to the customers how they can get in touch with us so they can access these services. And so these services, like I said, is heavily subsidized from the program itself. And the idea is to build it up and remove the subsidy over a period of about five years and maybe 6 years in some instances. So the strategy now has been to kind of get a spin onto this COVID outbreak, re-emphasize to our customers the need for good sanitation service delivery, encourage them to make these payments because from our books, there are minimum payments they're supposed to be making. But like you know, the people that live in these informal settlements, their income is very little and it's income they raise on a daily basis. So with the advent of COVID-19, it meant that they moved out from the places where they trade. They tried to restrict their movements. The customers that were regularly buying from them also reduced. So their income in general also has gone down. So this is setting us back again. So the strategy now is how can we spin this disease and try to explain to people to understand that sanitation is a key service that they need, and they need to provide services for this. If I may a little bit add even to some of the issues relating to government support in terms of providing to ensure that these workers do not lose their employment. Government has considered the water and sanitation service provision as essential and therefore supposed to be there working throughout this pandemic. So in essence, we've had to ensure that our PTMTs get vaccinations, some of the relevant vaccinations that are available, not for COVID-19, of course, but for some of the infectious diseases that are there, things like cholera or typhoid and so on. So we've had to vaccinate them against some of these illnesses, provided them with proper PPE, like I mentioned earlier on, introduce some of the requirements or guidance we've been being given of ensuring that they wash with water that has, with soap and antiseptic water to ensure that as they leave their workplace, they get back home, they do not carry with them any other disease. We are hoping that over time, they can be able to build for themselves a system of vaccinating their members against any disease that, the infectious diseases that come up because of the work that they do. But in terms of testing for COVID-19, for instance, that is a factor that the government is looking into. And so the Ministry of Health has provided some guidelines which allow for the operators and the general public and any institutions really to get in touch with them. So they've provided hotlines in which they can get in touch with people. We're encouraging also our operators to have their temperatures monitored, for instance, at least once a day as they get to work, to check that no one gets there that has a fever that may infect others as well.
Okay. And I now move to Eva. Eva, you are now clearly on the front line and must provide service at all costs despite the difficult condition. There is a study that has been conducted by the African Union that reveals that the number of poor will increase due to this disease. How you in Kenya do you intend to organize yourselves to continue to serve even the poorest household? Hello, Eva? Hello?
Hello? Hello?
Yeah, did you hear my question?
Yes, I did hear your question. I'm saying one of the most interesting COVID-19 positive response that has brought out is to us is the use of cleaning hands. So we found suddenly it's interesting to find that trucks have improvised their new innovations of putting a water cleaning process, a hand cleaning process in every tank. So usually before you would say like the operators, please clean your hands. Would you carry some water to clean your hands after you've finished the emptying business? And it was a bit difficult. But now it's now automatic because it's out there. It's been announced that there's a trace of COVID-19 into the wastewater. So the operator, the truck operator, finds themselves wanting to clean the hands before even and after. So it's really become a very easy process for that to be done. And the other thing that has also come out very interesting is even in the hospitals that are nearby, like in Nairobi, and even in Kenya as a whole, that the reduction of admission in hospitals has gone low. I don't know whether it's hospital admission is a psychological situation or not, but the diarrhea cases, typhoid cases, all of them have gone down. So the new innovations that have come, because there are so many new innovations of cleaning hands, protective gears, the pit emptiers, the manual pit emptiers, we've really been trying to talk to them about protecting themselves as they're handling this sludge. It's now an automatic, it's now a self-driven situation whereby you want to protect yourself. And that now has brought out the campaign of protection to come out very easily. And so we are hoping that it's going to continue the same and doing the emphasis the same. And the new innovations that have come out are also self-driven innovation. You look at your truck, you look at your business area, what innovation can you come up with of having hand washing, cleaning hands and water? How available is water? Before, when we would say, please clean your hands when you finish your operation. They're like, we can't get water. But suddenly they can find the water. So then it's now become a very self-driven situation. So that has helped us be able to do business. And also given the private sector from sanitation an opportunity to also start thinking of new innovation because of the hard situation of the economic value of business. Now it is again the same companies or the same private entities, the same us, who are now coming up with a new innovation. And if I find this can work in my truck, I also want to sell to another transport service provider. And so again, you find some are creating new business chain and new business channel. I would probably want to quote like Shaka, who is our Secretary General in Uganda, in Kampala. Shaka has a truck and he's been doing this business for quite some time. And now he's now producing sanitizers, and he's now become a sanitizer producer in Kampala, and it's moving very well. Moving fast, and also he's selling to the MTRs, he's selling to the people in the value chain within the sanitation industry, and now they are finding a need to buy, and especially because it is one of their own. So it's become a very interesting situation, and it's also created a lot of business opportunities for us to be able to see what new innovations can come in and complement what we've already been doing. And with those new innovations, we've seen the drastic reduction of waterborne related diseases in our countries. Thank you.
Okay, I think we need now to move to respond to the question of the participant. I've seen quite a number of those questions here. So I would like to, Monique is our MNE. Monique, what are the questions you have found pertinent to be answered by the panelists? Please, you have the microphone to raise those questions.
So the first question is addressed to Najib. What parameters are you using to select household for the voucher system for pit emptying? And do you intend to sustain this during the pandemic?
Yeah, thank you, Monique. Yeah, so we have a sanitation database, a citywide sanitation database. So this system was used quickly by our team to do a risk analysis based on areas which have very high poor toilet systems that can cause risk to pollution and also result into cholera outbreaks when full. So these are some of the areas that we are focused on. Using the community activation teams in these communities, we were able to select those households that have full pits. So the key criteria is identifying full pits that are about to overflow. And these are the ones that we focus on to give the voucher. So first, identify the risk areas. Two, within the risk areas, identify the toilets that are full. And these are the ones that we give the vouchers. So we move like that from one division to another until when we complete the whole city. And we hope to sustain this, we hope to sustain this through the framework contract I talked about. With support from government, we are getting a small fund to support these communities, even beyond COVID.
Okay. Thank you, Najib. So I could go to the next question. This is addressed to Eva. Given the COVID-19 situation and the possibility of some households losing income and ability to pay for services, is there any financial support to you as private sector to continue to provide sanitation services to these households?
Thank you. Not yet, I would say per se. Actually, right now, that's why I said earlier, we want to talk to the county governments. Kenya is a unique situation because we have the national government and then we have county governments. And county governments have been given, they manage their own counties. So they license in their own counties. And then we have the national, from the national government, yes, we have this conversation going on. From the county government is where now we are planning and we are engaging them to have this discussion on sanitation. The main focus has been on the health part of it, not on the sanitation part of it. And for that reason, the sanitation has not come out so clearly, so clean out. But actually how sanitation has come out is by seeing the reduction of diseases related to waterborne diseases in the hospitals. But it has not come out in the sanitation like what would it be an epidemic if we have a cholera outbreak, if we have this sludge getting out of context. That conversation has not yet come. So we are driving that conversation early, trying to speak to the CECs. Now those are like the county ministers for water and environment. We start engaging into this conversation. And I said again, because their focus is so much on the spread of COVID-19. So all the budget is allocated and it's going towards the bringing down the spreading of the COVID-19. But because COVID is a new norm, it's something that now we have to start to learn how to live with it and how to take control of it. Now that conversation is at the right time to have it being discussed. And we are engaging. We've been doing phone conversation. We've been doing follow-up conversations, but now we are likely to be getting a platform where this conversation can take a next step. So in the next step is where we will be able to see what waivers can they give in the licensing, how can we support each other to make sure that after we've taken control over the spread of COVID-19, we don't have another situation coming out because of poor sanitation. So those are conversations that are still at the baby stages of having them. We are not yet there, but that is the direction that we are going to.
Monique, another question from the participant.
Yes, okay, we have a question for Lungi. What have you government done to cushion the sanitation workers amidst this pandemic, please?
There's been just not targeted specifically at sanitation workers, but there's been an increase in social relief that is being provided by the South African government to people who have lost their jobs during this time, or people who are unemployed, and people who are living in the below the poverty line. So things like food parcels, there's a social grant that's going to be paid for the next 6 months to people who are struggling during this time. So there's a basket of services or basket of help that has been provided by the national government.
Okay. Thank you, Lungi. So I think there is a question addressed to Mr. Mayumbelo, please. So the participant is asking, considering that the information emerging now is that the COVID-19 is here to stay for some time, what plans have your utility put in place to sustain operation in the new normal?
Yeah, the new normal is more or less what government is also trying to let all utilities and all sectors operate in in that, like I mentioned, there is no lockdown per se in the country. But there have been guidelines that have been provided. The government, on the other hand, is set up through the disaster management unit, some units to see how essential services could continue. Like I mentioned earlier on, water supply and sanitation is a key service, is considered an essential service. And therefore, the operations have been, we've been asked to basically maintain the operations and to some extent even increase the level of operation. So to cover areas which were not serviced before, this is where I mentioned that we've had to get in some mobile tanks that we can put there and then use higher bowsers to deliver water there and so on. The company on its own has also put in place an emergency preparedness plan in the event that we'll have to come down to a shutdown like is obtaining in Uganda, for instance, to ensure that we sustain this service provision and also protect the employees against the disease or contracting the disease, while also protecting our customers for those employees that have to interact with them. So similar as has been done, I think, in Kenya, where we, or in South Africa, where we encourage people, those who want to settle some of their bills, to settle them through either mobile money arrangements, bank transfers, and other systems that don't bring into direct contact with our cashiers that collect income. We've also tried to avoid a situation where issues of complaints, people, customers working in the way they were working in before, but rather how this can be shared through online platforms and then this can be resolved through communicating. So the company has been preparing quite a lot in trying to ensure that their employees have the resources to work from home, like I mentioned, so through things like this Zoom or Skype and other systems, and also allow employees to access online systems that they require to do to carry out their work. For instance, the customer database that is sitting on a central server, the company is making arrangements of how employees can access this from when working from home. So the idea is to ensure that all employees continue working, but working safely. So those that can work from home, work from home. Those that can't work from home and are required, like those that go out in the field, go out in the field, but have the adequate protection to ensure that their health is protected.
Okay.
Thank you. Monique, is there
Yes.
a technical question that Kate could respond?
Yeah, we have a last question, which is the virus transmitted through wastewater, as indicated by some studies? If yes, what type of protection for sanitation workers you could advise, please?
Thank you very much for this question. Yeah, so we get this one quite a lot, and the short answer is no, it's not transmitted through wastewater. What we have seen is quite a few studies that have detected RNA fragments. So those are fragments of DNA. So, you know, there may be fragments of my DNA on this mouse. It doesn't mean there is a live Kate on this mouse. So that's what they're finding in wastewater. You're not going to catch it from there. And I think this is super important to bust this myth because, you know, you've all described many challenges you face with workers, and workers being afraid to come to work because they think they're going to get COVID from wastewater is really a problem you shouldn't have to be facing. So we are really trying to get this message out there as much as possible. The main transmission pathway is from respiratory droplets, so, you know, things that you cough up. And so we need to make sure that our sanitation workers have the normal protective equipment that they should have anyway for all diseases, but practicing also the hand washing, physical distancing measures that everybody should be practicing to prevent person-to-person transmission, not wastewater to person or sludge to person transmission. Also, sorry, while I'm speaking, I don't want to take too long, but just to say The survival time on surfaces is around 2 to 9 hours. That's quite a wide range and a little bit difficult to practically plan around. But the advice is, of course, to be disinfecting surfaces, and for municipal solid waste, if it's bagged and treated as normal waste, even if it's sitting on the roadside for a few hours, it's enough time for those pathogens to die off. So we don't want to be panicking about municipal solid waste potentially being infective. I also just wanted to two other quick things, which has really been positive, I think, in the comments, is in relation to, recognizing sanitation as essential service and using this opportunity to do many of the things that we knew needed to happen anyway. So the principle of build back better, formalizing services, making sure our workers have, vaccines and PPE. These are all kind of standard recommendations that, well, I don't want to say that COVID is a good opportunity, and nor was Ebola, but we did see a big new momentum around especially wash and health facilities after Ebola, and I think for sanitation service delivery there's an opportunity here to really accelerate some of these things. So one final comment was just around linking to some of the other big things that are happening. So you will see a big hand hygiene campaign coming through, and the work that the health sector is doing. We all have to really work, I think, in the sanitation sector to make sure we are visible within the health sector, because often, they're thinking about the medical things. And so really to latch on to that hand hygiene campaign and make sure our health colleagues know that we're here and that we're doing a great job for COVID, but also for all fecal oral diseases. So I'll stop there. Thank you.
Okay.
Just hold on, Kate. I just want to ask you a question. Do you have any idea of any study that is existing or that is ongoing now that deal with the intensity of health impact on sanitation worker? Maybe you can also share, and you can even share with us so that we share with the participant and our members. Do you have any idea of any study that deal with this intensity of health?
So I haven't seen anything on work for sanitation workers and COVID specifically, but we are currently working on an update of a systematic review to look at the collective health burden borne by sanitation workers, which is certainly not insignificant, and I think that will help to raise the profile of this issue.
So I have a question now to Lungi. Lungi, you are dealing with facilities, with treatment facility. Have you, due to this COVID, put in place in those facilities any testing methods? Are the workers going there tested?
The workers going in are screened, so we ask them for temperature and any symptoms that they exhibit, and we also provide the necessary PPE, wearing of masks, and social distancing. But there is, in South Africa yesterday, there was a launch of a study that will look at finding the RNA in wastewater, so that it can help to identify hotspots within the communities, that then can help the health workers to target that area for testing of COVID-19. So that was launched yesterday, and that should be starting soon. So using wastewater characterization to help the health workers in fighting this pandemic.
Yeah, and another question to now I address my question to Najib. Najib, we are now moving. There are some lifting measures that have been taken by government, but I want to hear from you. Is there any innovation that you can tell us that you want to implement or continue to for sanitation operator to continue to deliver the service to the population Is there any innovation or adaptation that you plan to implement, please? Hello.
Thank you, Yves. So, of course, it is very difficult to sustain services, especially for private operators, when they cannot access business from communities. Definitely in this part of the world, with the lockdown, especially in Kampala and Uganda, businesses have been disrupted, incomes have been disabled. You really find that communities' willingness and affordability to pay for basic services is going down. And that's why in Uganda specifically, you are having relief services like distribution of food and such items. So one of the bold steps we are taking is to ensure that at least these private service providers are able to access contracts or jobs that are guaranteed from government. And that's what I mentioned earlier, that with the little sanitation fund that has been provided, we are able to structure some contracts that actually, that at least provide some guaranteed income. And definitely with that, you are able to sustainably maintain these businesses. Besides support of PPE, free immunization, and other inputs into their operations. So for me, that's what I really see as a sustainable way of going forward, guaranteeing business for them to grow and continue providing a service at a fee.
Okay, thank you, Najib. We are moving time is passing very fast, and due to time constraint, we have not been able to respond to all the questions. I've seen some of them are still coming, but we will follow up to ensure that all the questions are answered and shared with the participants of this webinar. I would like to thank all the participants and the panelists, and I hope that you have been able to assess the situation of the sanitation service delivery, as well as concrete and appropriate African solutions that will contribute to improving the performance of public and private sanitation operators in the current situation. We invite you to stay connected and follow the other webinars that are organized by the African Water Association. The next one is on May 27 and 28, and we will be discussing the impact of COVID-19 on the finance of the African Water Company. Please do not forget to fill the survey, the quick survey that will follow just at the end of this webinar. It is on this word that we end this webinar. Thank you very much.